Hi everyone, this is Earvin Arbon. So in today's video, we tackle about Ncov or coronavirus. So here it goes. In December 2019, the city of Wuhan, Hubei province, China's seventh largest city, comprising 11 million residents, became the center of the phenomenal outbreak of unknown cause with global implications. The Chinese health authorities conducted the immediate investigation of these clustered cases to identify and control its spread by isolating suspected infected patients, closely monitoring their contacts, and obtaining detailed clinical and epidemiological data. In early January 2020, Chinese scientists isolated a novel coronavirus or COV from the patient groups in Wuhan. The outbreak is believed to have started at the local seafood wild animal market. Coronavirus or COV, first discovered in 1960s, are a large family of viruses. Some coronavirus cause illness in people, and others circulate among animals, including camels, cattle, cats, and bats. Rarely, animal coronavirus evolve into human coronavirus that subsequently infect individuals, and then they spread between people, such as occurred in previous outbreaks with severe acute respiratory syndrome or SARS in 2002 and 2003, and Middle East respiratory syndrome or MERS in 2012 to 2019, ongoing surveillance, right? And I have the example of coronavirus picture. So here it is. This is the example of coronavirus. This is the actual image of virus. So the coronavirus account for a significant percentage of common colds are transmitted in similar fashion, primarily via respiratory droplets, although they are often seasonally associated. Coronaviruses can cause fever as well as upper and lower respiratory symptoms. There are currently 7 known strains of human coronavirus. Here it is. Alpha coronavirus or HCOV229E. Alpha coronavirus or HCOV NL63. Beta coronavirus HCOV OC43. And beta coronavirus or HCOV HKU1. So, ladies and gentlemen, another coronavirus have 3 also. SARS-CoV beta coronavirus, MERS-CoV beta coronavirus, in 2019 novel coronavirus or 2000 Ncov beta coronavirus. What is currently known is that the 2019 Ncov is a beta coronavirus. As with MERS and SARS, all of which have their origins in bats, the sequence obtained from infected US patients are similar to the one that China initially posted, which suggests there is likely a single recent emergence of this virus from animal reservoir, beginning the outbreak. Early outbreak in respiratory illness in Wuhan, China. Many of the affected patients were linked to a large seafood and live animal market, suggesting animal to person spread. However, in the following weeks, our increasing number of patients reportedly had no exposure to animal markets. indicating ongoing person-to-person transmission. China official reported early in the outbreak of illness in Wuhan, China, affected patients were linked to a large seafood live animal market. The virus was introduced outside of Wuhan by infected travelers, mainly by air and train. On January 13, 2020, the first international case outside China was reported in Thailand, whereas the first cases outside Wuhan but China were reported in the cities Guangdong and Beijing on January 19. The following day, not only did China's National Health Commission, or NHC, confirm person-to-person spread was ongoing, but Japan and South Korea also confirmed cases of 2019 Ncov by January 21. The United States and Taiwan detected several more provinces in China reported new cases, including infections in 15 healthcare workers and 6 fatalities. On January 22, 2002, the World Health Organization or Emergency Committee convened the third term where classified the outbreak public health emergency of international concern. They declined to do so, offering opinions, agreed to meet again the 6th day further evaluate. The next day, the U.S. Department of State's on departure of non-emergency U.S. personnel and their families from Wuhan. The affected regions including the following: Asia, Cambodia, China, including Hong Kong and Macau, India, Japan, Republic of Korea, Taiwan, Thailand, Singapore, Vietnam, Nepal, Malaysia, Philippines, Sri Lanka, and United Arab Emirates. And also in Americas, Canada, United States. In Europe, Belgium, Finland, France, Germany, Italy, Russia, Sweden, and United Kingdom. And Australia, in Oceania, Australia. At this time, the 2019 Ncov is not spreading widely within communities in the United States. Best practices for the general public to prevent infection respiratory viruses include washing hands with soap and water. If not available, use hand sanitizer with 60% alcohol. Avoiding touching the face with unwashed hands. Avoiding close contact with people who are ill. Staying home with ill. Using tissues cover coughs, sneeze, and cleaning. Disinfecting frequently touched objects or surfaces. If an individual develops a fever or signs or symptoms of respiratory illness, such as cough or dyspnea, within 14 days after travel from China, if they have close contact with someone showing these signs, symptoms, who has recently traveled from China or been exposed that has, then they should be called ahead from healthcare professional mention of travel or their close contact recent travel. To minimize the risk of spreading of the infection, individuals who meet the above criteria should be asked a surgical mask as soon as they are identified, should be separated from others. 6 feet or 2 meters, ideal in the airborne infection isolation from air. Healthcare personnel and others with close contact with this individual should be standard contact and airborne precaution, as well as wear eye protection. Although comparison of fatality rates between the Ncov other human beta coronavirus will likely change during the lifespan of current outbreak. So, we need to take good care of ourselves. So, we need to wash our hands, use sanitizer or this mask. So you need to get the mask like this and put in your face or in your mouth like this. Make sure that